For many years now, Nigeria has had no record of yellow fever cases, the communicable disease that is transmitted through mosquito bites from infected humans and monkeys. While many think yellow fever is no longer a threat in Nigeria, another outbreak of the disease was recorded in Katsina State, where about 115 people have been reported to have lost their lives. Now, this has posed serious concern to healthcare managers in the country. This continuous outbreak has put public health experts, including the Nigerian Center for Disease Control and concerned Nigerians, on their toes, all in search of solutions to curb any further spread. This informs our focus on this edition of the program. Welcome, this is Nigeria Today, and I am Dennis Adigunloye. All right, in the studio to discuss ways of curbing the outbreak of yellow fever is Biodun Oguni, epidemiologist at the Nigerian Center for Disease Control, NCDC. You're very welcome to Nigeria Today.
Thank you, Dennis, for having me.
You're welcome. And also joining us is Dr. Aminu Magashi Garba, Coordinator, Africa Health Budget Network. Welcome also to Nigeria Today.
Thank you very much.
All right. Okay, like I said in my opening intro there, Katsina recently had a case of about 115 persons who have died of yellow fever. Let me come to you first, Dr. Aminu. What is the implication of this?
Thank you very much. I think having 115 people already dead due to yellow fever, that tells us that we need to be all on our toes. This is a communicable disease, moving from one person to another due to by infected mosquito, the Aedes family. Okay. And you know, in Katsina, which is part of the northern Nigeria, it's a tropical part of the country. Mosquito is everywhere. It means that if we don't do something quickly about it, then more people are going to get infected. And don't forget that we have a lot of stagnated water. We have a lot of gutters all over the place in that part of the country. It means that the Aedes mosquito will continue to spread the yellow fever. It means it is an emergency that has to be addressed quickly.
Okay, this particular family of mosquitoes, it's unique to the north in Katsina State, or is it common in other parts of the country?
No, it could be seen everywhere. We have the Anopheles mosquito that spread malaria. Then we have the Aedes mosquito that spread the yellow fever. And that mosquito could also be found in many places, not only that part of the country.
All right. Okay, Biodun, in yellow fever, it's obviously a disease that's been with us in and out for decades now. Just to highlight the basics of yellow fever for us. The basic symptoms and obviously how one addresses it once the early warning signals are faced.
All right, thank you very much. To start with, I'd like to say that for us at the Nigeria Center for Disease Control, we are not aware of that report that we have 115 deaths. Maybe you talk about cases, because total deaths from January till now in the country from yellow fever has been 90 from our records. So, and I think the proportion of what Katsina contributes to it is less than 20%. Now, having said that, coming back to the discussion around the symptoms to look out for, yellow fever, just like some other viral hemorrhagic fevers, does not present in the early phase with specific symptoms. You have the common non-classical symptoms like a headache, like fever, where you drew the name from. We have the patients could start having vomiting. It's at the later phase of the disease, maybe after the initial recovery, when the patient now progresses to a later phase, that jaundice comes up, and that is the yellowness of the eyes, where it becomes so classical to say. And at that phase, it can involve the organs of the body, the kidney can be involved, and later on, the patient can start bleeding from other parts orifices of the body, from the nose, from the mouth, and all that.
What is the time frame from initial infection to where we get to that jaundice?
So it's just within. Okay, for infection itself is within 3 to 6 days when the person gets exposed to the virus. based on the body's immune system and the response, if it's susceptible, within 3 to 6 days, symptoms will likely come up.
Okay.
And most patients, when they have that, they recover. But after 4 days, if there is no recovery, after the initial 4 days, the patient goes into the next phase of the disease.
Okay.
And so it's after 4 days of the initial recovery that if there was no recovery, then the patient goes into the next phase of the disease when it gets really complicated, and in most instances that could result to death.
Okay, so the incubation period of yellow fever is quite short.
It's very short, 3 to 6 days.
Wow. Okay, Dr. Aminu, how then should first aid be administered immediately to those who may be suspected of having contracted yellow fever?
So if already there's a suspicion, you know, that a particular person has been infected with yellow fever, as my brother mentioned, in the initial stage, it could equally mimic like malaria. It could be mimicking like any fever that we have been seeing in this country. But if there is a high index of suspicion that it is actual yellow fever, and the person already started showing symptoms and signs, that person should go to hospital or should be taken to hospital. And because right now there's no antiviral drug, for the yellow fever, so at the facility the person will be treated to address to reduce complications, to stabilize the patient. If the patient is dehydrated, like the person has lose a lot of water, so he will be rehydrated, given some drugs to reduce the fever, and also some of them will have vomiting, and some will have nausea, backache, and headache. So all this should be addressed, and we need to ensure that that patient does not progress to more severe complications. So timely administration of treatment would be key to curb the complications and also the severity of the yellow fever. Okay,
as far as the NCDC is concerned, what is responsible for this recent outbreak that is being witnessed?
At the Nigeria Center for Disease Control, this outbreak actually has been monitored since 2017, when the incident started in Borno State. And after then, last year, we've had a series of cases in some of the states of the country. And at the last count, we have more than 25 states that have reported confirmed cases of yellow fever. And so when we ask the question about what is responsible for the outbreak, because of the ubiquitous nature of the vector of this disease, which is this Egyptian mosquito, it is called a container breeder mosquito species, wherein wherever you have pools of water in buckets container, it's easy for it to multiply there. And because there's massive movement of people here and there, it's easier for mosquitoes to get easily tag along. I've seen instances like that people, even with their luggages, carry mosquitoes in their luggages and move to places. And so it's easy for mosquitoes to move along with people. And when they get to wherever they are, they produce massively. Mosquitoes produce massively. And because of that, once one of them has been infected, it is able to reproduce eggs that have also been infected.
Wow.
And so with that, if you produce 1,000 eggs, all those eggs are infected. And so wherever those eggs are, they keep infecting people. And that is what, wherever the eggs become mosquitoes, of course, they are already infected, and so they can now transfer the infection to people. Wow. And so with that, with more exposure, and if people fail to report, and that is a concern we have, when anybody is infected with the disease, early reporting to the nearest health facilities helps a lot, because when they don't report, even the non-infected mosquitoes can pick the virus from the infected person, and becomes the cycle continues again.
Wow, that is quite a scary prospect. In that case, Dr. Amin, what's, in terms of the health budget network, what are you doing in terms of sensitizing the public on this critical point that Biodun raised on, in terms of notifying healthcare officials?
So
in any case,
it's very important and crucial for everybody to report and notify the Center for Disease Control in Nigeria about the yellow fever. If there is suspicion, it should be reported. Then they have the responsibility to verify and confirm through laboratory investigation. Also, we from the budget advocate, it's also important for the Nigerian government and all the states government in Nigeria to commit resources, funding, human resources. We need to ensure massive vaccination against the yellow fever. This also requires money. So we hope that all the governors where there's outbreak, there should not be any delay in committing resources. And also, don't forget that the yellow fever, because of the international community, people are watching the country. Once they begin to hear news about the outbreak, even those who are traveling abroad, they'll be asked to really confirm that they have a valid yellow fever vaccine card. It means that everybody must be on deck to curtail the menace of the yellow fever.
Sure. I wish I could put a rider to that.
Continue.
That having a yellow fever vaccination card does not confer immunity on the person holding it.
Okay.
What confers immunity is being vaccinated, because we've had people who procure the cards without being vaccinated. So we need to be cautious of that very point.
Absolutely. And it is a vaccine preventable disease. In times past, we used to have a one-shot vaccine. But nowadays, it's a one shot for life. Back in the previous one lasted for, I understand, 10 years.
Exactly,
so what is the actual difference in terms of this?
Do you want to comment, the CDC?
So I think it's about advancement in research.
Okay.
When anybody gets infected with Lassa fever, if they recover, it confers lifelong immunity on them.
Okay.
So basic understanding of immunology helps us to know that definitely with this other viral, vaccines that has been administered, there has not been reoccurrence of the cases among those who have been vaccinated. And so it's the same principle. If you have been infected and you recover and you're not able to get infected again, the same vaccine, which is now being introduced into the system, is able to achieve the same thing.
Okay. In terms of the vaccine then, Dr. Aminu, I'm sure it's no surprise that it is a free vaccine that anyone can take.
Yes.
In terms of accessibility to this vaccine, how easily accessible is it, especially for those in rural areas?
So the government has provided the vaccine. We need to thank the Center for Disease Control and all the government agencies and the Nigerian government that vaccines are available. Even when you go to airport and you are not vaccinated, you can walk into the Port Health clinic, and I got my vaccine actually in a Port Health clinic, and also in many the states in Nigeria, vaccines are also available here in Abuja and so many other places, and it's free. People should be encouraged to get the vaccine.
So there's not one kobo that is paid for anything concerning the vaccine. Just be 100% clear on this.
Okay, I'm sure from what the experience is narrated, when you go to Port Health Services, you are going to pay something, you pay a token. But it's suffice to say that vaccine for yellow fever is on the routine immunization schedules for children at the age of 9 months.
Okay.
So it is available in all our health facilities. Children should not be deprived of this opportunity. As long as they're 9 months, they should be allowed to access the vaccine, and it is free for them. Other state ministries of health can also be contacted across the country on how to obtain the vaccine. Vaccines are the yellow fever vaccines are very safe, very effective, and very much affordable. And it's available for us. It is best to take it and remain safe and be protected from the disease.
Absolutely. All right. You are watching Nigeria Today. Let's now take this topic to the streets, where our correspondent Victoria got the thoughts of some Nigerians. We'll be right back.
I don't know much because I'm not a medical doctor, but I know that it's an infectious. That when you are contacted or when it's happened to you, you feel uncomfortable and you need to go to for medical care for you to be treated. That is all I know about yellow fever.
Yellow fever, lack of malnutrition, poor water intake that leads to jaundice, yellowing of the eyes. Mostly, I think it's been attached with people with AS.
For instance, I get to get mad at, okay, what is yellow fever? I've been hearing yellow fever, but who are the victims of yellow fever? I can't tell.
Poor sanitation, poor water, and poor environment. That's why we have water shortage, and then unhygienic water during dry season mostly, and then things like that cause a dirty environment, cause a yellow fever.
I've been hearing it, but at least the only thing that I know that can be the cause, it is when they text you that they will know the causes of the yellow fever.
Yellow fever is a disease. It's a very terrible disease. that I was thinking that if you have it, you started maybe catching a cold or something else, or your body will be hot.
All right, welcome back. The program is Nigeria Today, and our focus is on curbing the outbreak of yellow fever. And our guests are still with us: Biodun Oguni, epidemiologist at the Nigerian Center for Disease Control (NCDC), and Dr. Aminu Magashi Garba, coordinator, Africa Health Budget Network. Dr. Aminu, how would you say, how well do you think Nigerians understand the disease that is yellow fever and how it can be managed effectively?
Well, going by what we just saw in the report, it means we have to do a lot of awareness creation.
Yeah.
People know the yellow fever only with the yellowish of the eye, just from the name. But there's a lot of information awareness that we need to do for them to understand the simple symptom and sign, and also what to look out for to have the highest index of suspicion about the yellow fever. So we need to do more awareness creation through the television, like what we are doing now, the radio, both in local and local languages all over the country, and also, of course, all the government agencies, they have to step up the awareness creation, for the yellow fever.
All right. Biodun, the 2020 budget, I'm sure it comes as quite some good news to many that 70% of the proposed budget is going to, for health, is going to immunization and vaccine. What would you say this means for other areas in the health sector?
Very good news for the Nigerian sector, sector in particular. Yeah. Yellow fever is a vaccine preventable disease. And investment in these vaccines, which currently is not optimum, will really not make it, be readily available for all those who need it. And for us to achieve effective coverage for the population to be immunized against the disease, there must be more than 80% of the population immunized against the disease. Vaccinated and immunized against the disease. Yeah. And so with that, for us to achieve that, because it is in short supply, vaccines for yellow fever is in short supply globally. It's only majorly available for emergencies and those few routine services. And there's need for much investment, especially with public and private sector engagement, to ensure that vaccines are readily available. Yellow fever is a disease that can be eliminated. Yeah. And the strategy of the World Health Organization in line with this to ensure that there is collaboration among stakeholders of government, partners, public and private, to ensure that there is more investment in this direction. And talking about the need for awareness creation within our society, rather to the question you raised earlier on, we have different strategies to address this within the Nigeria Center for Disease Control, for instance. We have engagement to the community at the community level, wherein we train community mobilizers on how to create awareness within the grassroots, because our focus is to partner with the states. We do nothing without working with the states. We are there to support the state structure and not to take over their processes. And so we support them, we provide training, we provide technical guidelines for them to use to be able to handle this. We train the clinicians also on need to identify for index of suspicion. And let me quickly add that as of 2017, when we had the first, the index case in the country, we only struggle to have a lab that can, a laboratory that can really test for Lassa fever. Today we have 3 with very functional, supporting by the operations we do. And so this is the progress we have made in this regard to ensure prompt detection. And so we encourage the general populace that whenever there are symptoms, not all cases of jaundice are yellow fever. Let's not forget. And so there is a need for them to report to the health facilities early, and there is a need for them to get tested. And there's also the need to invest in, make sure that there are more testing centers for Lassa fever, yellow fever rather, in the country.
Okay. Dr. Aminu, let's get your take on this 70% proposed budget for the health sector in terms of immunization.
So, as my brother said, it's a good news. That 70% means 32 billion naira within the 46 billion naira of the health sector capital budget is going to immunization. So this is good news for the Nigerian children, for the mothers, and for everybody. We, the advocates of budget, we're also happy. What we need to encourage the government is to release the budget on time. When the budget is signed into law, to release the budget on time to all the relevant agencies so that they can use that funding to procure more vaccines, and also use the money for logistics to distribute the vaccine where it should be. But we commend the government for putting 32 billion naira for immunization in the budget.
Yeah, well, both the executive and legislature are working tirelessly to get us back to a January to December budget cycle. So hopefully that will certainly be the case. In terms of transmission, is it only through mosquitoes, or is it possible for human-to-human transmission of yellow fever?
Well, so I would say, but then the CDC can come in. So it is there has to be a vector.
Okay.
That's the Aedes
Agent
mosquito, just like the malaria. So simply because people are sleeping in the same room, and if there's no vector, then they will not be able to pass on the infection. But he can also add more from the CDC.
Go ahead.
Right. Okay, so if I could take that up, there is no record of human-to-human transmission of yellow fever.
Okay.
Maybe by body contact or anything. The virus has to be picked up by the mosquito. It completes a cycle, a part of its cycle in the mosquito before it gets introduced into another host. Okay. And so as long as the vector is not available in our environment, and that is why it's one of the diseases that are easy to get eliminated, by ensuring those preventive habits, ensuring that we don't allow water to gather in an environment where the mosquitoes can breed. And a classical example is all these our used tires. You see them, we drop them everywhere, the rains fall, the water gather in them, and the mosquitoes are having a free day breeding. So when we ensure that all those areas where the mosquitoes can breed are taken care of, which is one of the things we're committed to in NCDC, providing this information to the people, it is very much easy to prevent the transmission to continue. So it is basically a transmission from a vector-based transmission from mosquito picked to human, and it continues like that.
All right, Dr. Magashi, what would be your, give you the people your advice in terms of any thoughts of maybe I've got yellow fever, what do I need to do? Just to advise the public briefly,
so our advice is simple. Vaccines are available, and as we heard, from the CDC, they are free. They are part of the routine immunization schedule for children from 9 months and above. And also the adult can also get the yellow fever vaccine. And once they get the vaccine it has a life protection. So we need to call on everybody to get vaccinated.
All right, Biodun, your last comments?
Okay, so the Nigeria Center for Disease Control remains committed, fully committed to ensuring that Nigerians' health are protected against infectious diseases. And we all have a role to play by ensuring that we take preventive measures as basic issues around hand hygiene, as basic issues around environmental sanitation, ensuring that the environment does not support the breeding of these vectors, whether it is rat, whether it is mosquito. And to ensure this is happening, we also encourage our people to report early to health facilities when they have symptoms of disease, and avoid self-medication, which is one of the things that lead to the drug that will not eventually work when the disease happens. And we continue to sensitize ourselves and the entire public.
All right, very good. This is where we wrap the program up on today's edition of Nigeria Today. Thanks to our guests, Biodun Ogunniyi, epidemiologist at the Nigerian Center for Disease Control, NCDC. Thanks very much for your expertise on this topic.
The pleasure is mine.
And also thanks to Dr. Aminu Magashi Garba, Coordinator, Africa Health Budget Network. Thanks also, sir, for your insights.
Thank you very
topic.
much. Thank you.
All right. And to our esteemed viewers, thanks for watching, and do log on to our YouTube address, youtube.com/NTA News 24 Hub to watch this or any other episode of the program. I am Dennis Adigunoyo. Thank you for watching.